गुड इवनिंग एवरीबॉडी, नमस्कार। सभी का आज के सेशन में हार्दिक स्वागत है। मैं डॉक्टर नेहल शाह, ऋतुजा चैरिटेबल ट्रस्ट की ओर से आप सभी का आज वर्ल्ड मेनोपॉज डे पे हार्दिक स्वागत करती हूँ और आशा रखती हूँ कि आज का ये हमारा सेशन, हमारा एपिसोड आपको बेहद पसंद आएगा और आपको बहुत सारी जानकारी एवं टिप्स यहाँ से मिलने वाली है। तो चलिए आज जानते हैं कि ये वर्ल्ड मेनोपॉज डे जो 18 अक्टूबर को मनाया जाता है, इसका 2024 2024 इस साल का थीम क्या है। तो एक जो एक ट्रीटमेंट जो मेनोपॉज के लिए है, हार्मोनल ट्रीटमेंट। सो हार्मोनल थेरेपी जिसे बोलते हैं, हार्मोनल रिप्लेसमेंट थेरेपी, HRT। इसको लेके इस साल की जागरूकता को ज़्यादा महत्व दिया गया है। काफ़ी लोग इसके बारे में नहीं जानते हैं और काफ़ी इसके बारे में मिसकंसेप्शंस भी हैं। तो इसलिए इस साल का थीम है कि कैसे हम HRT के बारे में ज़्यादा से ज़्यादा इंफॉर्मेशन प्राप्त करें। हर साल एक नए थीम के साथ वर्ल्ड मेनोपॉज डे मनाया जाता है और जैसे हम जानते हैं कि ये रजोनिवृत्ति पीरियड बंद होने का एक ऑफिशियल अनाउंसमेंट है। पर ये पीरियड बंद होते होते भी काफ़ी सारी तकलीफ़ें देके जाता है और इसकी वजह से काफ़ी मानसिक शारीरिक प्रॉब्लम से महिलाएं गुजर सकती हैं। तो उससे कैसे निपटा जाए, कैसे उसे टैकल करें, उसके लिए आज हमारे पास एक दो नहीं बल्कि तीन तीन एक्सपर्ट्स हैं जो आज हमारे इस कार्यक्रम में आएंगे और आपको बहुत सारी वैल्यूएबल टिप्स देंगे। तो अगर आपके पास कोई क्वेश्चंस हैं उनको पूछने के लिए, कोई कमेंट्स, कोई सजेशंस हैं, तो ज़रूर से यूट्यूब के कमेंट बॉक्स में टाइप कीजिएगा। उनके पूरे सेशन के अंत में मैं आपके क्वेश्चंस और सजेशंस ज़रूर से लूँगी और आपको अपने क्वेश्चंस के आंसर्स मिलेंगे। तो चलिए पहले अपने गेस्ट्स को इनवाइट करते हैं। हमारे साथ जुड़ी हैं डॉक्टर पूर्वी पटेल। मैम, गुड इवनिंग, वेलकम टू द शो।
थैंक यू।
और हमारे साथ जुड़ रही हैं डॉक्टर मोनाली गांधी जो फिजियोथेरेपिस्ट हैं।
गुड
गुड
इवनिंग।
इवनिंग मैम, वेलकम टू द शो। वी आर वेरी ग्रेटफुल कि आप ऋतुजा के प्लेटफॉर्म पे इतना टाइम लेके आई हैं।
थैंक यू।
और फ्रेंड्स, हमारे साथ एक और जुड़ने वाली हैं जो बहुत ही स्पेशल आपको कुंडलिनी योगा के बारे में बताएंगी, उनकी टिप्स देंगी। पर गेस्ट इज लिटिल बिजी, वो हमारे साथ कुछ ही मिनटों में ज्वाइन होंगी। तो चलिए तब तक हम आगे चर्चा बढ़ाते हैं। तो जैसे आप देख सकते हैं हमारे साथ बहुत ही बेहतरीन दो एक्सपर्ट्स आज जुड़े हैं। तो मुझे आपको उनके बारे में थोड़ा कुछ बताने का मौका दीजिए। डॉक्टर पूर्वी पटेल जो हैं वो है एक रिनाउंड मेनोपॉज स्पेशलिस्ट और होम्योपैथिक कंसल्टेंट। ये ऑथर भी हैं दो बुक्स का। उन्होंने एक बुक लिखी है मेनोपॉज पे और एक पॉजिटिविटी को लेके हैं। शी इज ऑल्सो द फाउंडर ऑफ एम्पावरिंग दीवास हब। काफ़ी सारे अवार्ड्स पा चुकी हैं और इनकी हमेशा से ये कोशिश रहती है कि ये 35 प्लस की महिलाओं के लिए काम करें, उनकी सेहत और उनको वर्क लाइफ बैलेंस में कैसे मदद रूप हो, उसके ऊपर उनकी पूरी कैरियर, प्रोफेशन या आप जो भी बोले मोटो, मैडम का यही एक पूरा मोटो है और उसके लिए वो कोशिश उनकी रहती है कि वो खुद अपडेट रहें। ये माइंडफुलनेस कोच भी हैं, NLP भी जानती हैं और काफ़ी सारी अलग अलग टेक्निक्स और थेरेपीज को समझने के बाद उन्होंने अपना एक खुद का कोर्स का पैकेज किया है, जिसकी वजह से काफ़ी महिलाओं को ये मदद रूप होती हैं। ये होपन भी जानती हैं, लाइफ कोचिंग भी करती हैं, डाइट और न्यूट्रिशन में भी काफ़ी एक्सपर्टीज़ रखती हैं और जो विमेन को पेरी मेनोपोज से लेके पोस्ट मेनोपोज की जो तकलीफ़ें हैं, उन सब की चैलेंजेस को कैसे कवर अप करें, उसके लिए मैडम अपना काफ़ी सारा पर्सनल एक्सपर्टीज लोगों तक शेयर करती हैं। Through her innovative programs, including Blossom Through Menopause, Dr. Purvi has helped many women to overcome different symptoms which they face during this phase. So, welcome once again, Dr. Purvi. We are very happy to have you on Rutuja and hope आज के कार्यक्रम में काफ़ी सारी महिलाएं आपके टिप्स और गाइडेंस से लाभान्वित होगी और दूसरी जो हमारे साथ जुड़ी हैं, बहुत ही यंग और खूबसूरत और नो प्यारी सी डॉक्टर मोनाली जी। तो मुझे बताने दीजिए कि मोनाली जी एक ऑर्थोपेडिक फिजियोथेरेपिस्ट हैं। इनकी भी 3 से 4 साल से इनकी ऑर्थोपेडिक फिजियोथेरेपी में प्रैक्टिस चल रही है। ये नो लेजेंडरी म्यूजिक कंपोजर जैसे कि श्री प्यारेलाल जी, टीवी सेलिब्रिटी श्रुति व्यास और इलाइट स्विमर्स, फॉर्मरली सीनियर क्लिनिकल थेरेपिस्ट एट खार फिजियोथेरेपी क्लिनिक। इन ये जो मैं आपको नाम जो बता चुकी हूँ, लेजेंडरी म्यूजिशियन और टीवी सेलिब्रिटी, इनकी ये पर्सनल फिजियोथेरेपिस्ट रह चुकी हैं। सो इन्होंने काफ़ी लोगों की इस तरह से मदद की है। डॉक्टर गांधी हैज़ ऑल्सो सर्व्ड एज ऑन फील्ड फिजियो फॉर ओपन मेट गाला स्विमिंग competition at Khar Gymkhana. Her specialties include treating musculoskeletal disorders and providing tailored fitness programs. So ये आपको आज बहुत ही टेलर्ड डिज़ाइंड टिप्स देंगी कि मेनोपॉज में जो सारी प्रॉब्लम्स होती हैं फिजिकल और मस्क्यूलर प्रॉब्लम्स, क्योंकि एस्ट्रोजन कम होते जा रहा है, तो उसको कैसे मैनेज किया जाए। तो चलिए, अब मैंने बहुत बोल लिया। मैं समझती हूँ कि आपकी एक्साइटमेंट होगी कि एक्सपर्ट्स क्या कहने वाले हैं। तो शुरू करते हैं डॉक्टर पूर्वी जी से। पूर्वी जी, द फ्लोर इज़ ओपन टू यू। प्लीज़ आप हमें बताएं कि ये मेनोपॉज के चक्कर में से कैसे बाहर आएँ और इसे कैसे पॉज़िटिव बना के चलें, क्योंकि बहुत सी लेडीज़ हैं जिनको जैसे पीरियड एक एक प्रॉब्लम हो चुका है कि हर महीने आ रहा है, वैसे ही मेनोपॉज से गुज़रने वाली लेडीज़ की भी अनेकों अनेक प्रॉब्लम्स हैं जो काफ़ी बहुत ही माने कॉम्प्लिकेटेड भी रहती हैं और समझाना भी मुश्किल है कि मुझे ऐसा हो रहा है। और इन सब चीज़ों में कोई छुट्टी-वुट्टी तो देता नहीं है, तो काम तो करना ही है, घर का भी करना पड़ता है, ऑफ़िस का भी करना पड़ता है। तो इन सब चीज़ों से कैसे वर्क लाइफ़ बैलेंस मैनेज करें और लाइफ़ का एक जीने का अंदाज़ इसमें कैसे हम ऐसा पैदा करें कि सकारात्मक रहते हुए हमें जीना अच्छा लगे, ना कि एक दुश्वार हो जाए कि कैसे इसको टैकल करें, और आधी ज़िंदगी तो ऐसे ही निकल जाती है और फिर 5-6 साल मेनोपॉज़ में निकल जाते हैं। तो महिलाओं के लिए बहुत कई बार दुखद और फ्रस्ट्रेटिंग भी हो जाता है। तो प्लीज़ आप बताएँ दर्शकों को कि क्या किया जाए?
सबसे पहले तो थैंक यू सो मच डॉक्टर नेहल शाह फॉर हैविंग मी ऑन द ऋतुजा चैरिटेबल ट्रस्ट प्लेटफॉर्म। यस, सारी महिलाओं को जो भी ये देख रही है उन सबको हैप्पी वर्ल्ड मेनोपॉज डे। सो मेनोपॉज, द वर्ड इटसेल्फ सेज देयर इज नो पोज, यानी कि रुकना मना है। कौन रुका है? तो जो हर महीने की जो माहवारी है, जो आपको मेंसेस आता है, वो रुक जाता है। आपको कहीं पे भी नहीं रुकना है, ना तो आपकी सेहत को रुकना है, ना तो आपकी एंथुसियाज्म को रुकना है, ना तो आपकी खुशी को रुकना है। कहीं पे भी रुकना नहीं है। सो मेनोपॉज मीन्स नो पोज इन एनी एक्टिविटीज। तो मेनोपॉज क्या है? मेनोपॉज ऐसा ही एक फेज, एक लेडीज की लाइफ में, जैसे एक लेडीज की लाइफ में एक मेंसेस का फेज आता है, उसके बाद एक प्रेगनेंसी का फेज आता है, वैसे ही एक तीसरा और आखिरी फेज है। आप बोल सकते हैं कि तीसरा आखिरी पड़ाव एक महिला की जिंदगी में आता है, जहां पे उसको ये पड़ाव के बाद अभी सारी तकलीफें चली जाने वाली है। तो इस पड़ाव को ऐसे नहीं देखना है कि अरे बाबा मुझे मेनोपॉज आ गया, इतने सारे लक्षणों से जूझना है, मैं क्या करूं, डरना नहीं है, बल्कि उसको पॉजिटिव वे से लेना है। क्योंकि मेनोपॉज का मतलब ये नहीं है कि हार्मोनल इम्बैलेंस हो गया, हॉट फ्लशेस हो गया, है ना, मूड स्विंग्स हो गया। तो ये मेनोपॉज नहीं है। मेनोपॉज का मतलब है दूसरी जिंदगी, एक ऐसी जिंदगी जहां पे आपको एक अपना नजरिया अलग बनाना है। So basic term menopause in scientific way is that it's a transitional phase in a woman's life which makes end of a reproductive years। यानी कि मेनोपॉज होने के बाद आपको बच्चे नहीं हो सकते हैं, क्योंकि आपकी जो ओवरी है वो काम करना धीरे 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 बंद कर देती है। ठीक है। सो आप मेनोपॉज़ में, इस मेनोपॉज़ के 3 फेज़ होते हैं, पेरीमेनोपॉज़, मेनोपॉज़ एंड पोस्ट मेनोपॉज़। सो पेरीमेनोपॉज़ का जो आपका फेज़ है, वो स्टार्ट होता है 35 से लेके चलता है वो 45-50 साल की उम्र तक चलता है, यानी मिनिमम 8 से 10 साल। फिर आता है मेनोपॉज़ का फेज़। अब कैसे मालूम पड़े कि आप पेरीमेनोपॉज़ से मेनोपॉज़ में आ गए? तो जिन महिलाओं को कम से कम 1 साल यानी कि 12 महीना तक लगातार मासिक नहीं आता है, उस महिला को आप बोल सकते हैं कि वो अभी मेनोपॉज़ के स्टेज पे आ चुके हैं, और ये जो स्टेज है, वो 45 से लेके 55, कई-कई बार 60 साल की उम्र तक भी मासिक आता है। तो फिर आपको 60 साल को मेनोपॉज़ आएगा। जब आपका मासिक बंद होता है, 12 महीनों तक कंटिन्यूअसली मासिक नहीं आना चाहिए, तब उसको बोलते हैं आप मेनोपॉज़ के स्टेज में हैं। मेनोपॉज़ के बाद के जो साल है, 5 साल, 6 साल, जो भी आपकी लाइफ़ आप जिएँगे, वो जो साल है, उसको बोलते हैं पोस्ट मेनोपॉज़। और ये सारी महिलाएँ इस फ़ेज़ में आती ही आती हैं। तो आज हम जिस फ़ेज़ के बारे में बात करने वाले हैं, उस फ़ेज़ को बोलते हैं पोस्ट मेनोपॉज़ फ़ेज़ में क्या-क्या तकलीफ़ें महिलाओं को होती है। क्योंकि जब महिलाएँ पेरीमेनोपॉज़ और मेनोपॉज़ में भी अपना ध्यान नहीं रखती है, खान-पान को चेंज नहीं करती है, एक्सरसाइज़ को अपना रूटीन नहीं बनाती है, और जैसे ही वो लोग लाइफ़ जीते हैं, स्ट्रेस, एंग्ज़ायटी, वो सबको झेलते हुए वो लोग जब ये आगे बढ़ते जाते हैं, तो पोस्ट मेनोपॉज़ का जो फ़ेज़ आता है, वहाँ पे ये सारी तकलीफ़ों का रिज़ल्ट आता है कई सारी बड़ी बीमारियाँ। ऐसे तो कई सारी बड़ी बीमारियाँ होती है, जिसमें रहता है मसल्स और बोन्स से रिलेटेड बीमारी, जैसे कि आर्थराइटिस, रूमेटॉइड आर्थराइटिस, ऑस्टियोआर्थराइटिस, लोअर बैक पेन, स्पाइनल कॉर्ड में प्रॉब्लम आना, गादी खिसक जाना। देन आपका आता है डायबिटीज़, हाई ब्लड प्रेशर, हार्ट से रिलेटेड प्रॉब्लम, ब्रेस्ट कैंसर, अल्ज़ाइमर डिसीज़, कोलोन कैंसर, थायरॉइड जैसी बड़ी-बड़ी बीमारियाँ आपको हो सकती है। तो आज हम इन्हीं कड़ी बीमारियों में से 2 बीमारियों के बारे में आज सबको मैं बताना चाहती हूँ, क्योंकि ये 2 बीमारियाँ आजकल बहुत ही कॉमन हो चुकी है पोस्ट मेनोपॉज़ की महिलाओं में, यानी कि 55-60 के अबव। इन सारी महिलाओं में ये बीमारी बहुत बढ़ चुकी है, और वो 2 बीमारियाँ हैं हार्ट प्रॉब्लम और ब्रेस्ट कैंसर। हार्ट प्रॉब्लम यानी कि कार्डियोवास्कुलर इम्पैक्ट ऑफ मेनोपॉज़ क्यों होता है? कभी आपने ये सुना है कि 35 साल के नीचे की उम्र को हार्ट अटैक आया, महिला को हार्ट अटैक आया, और रेयर केस में शायद 0.1% केस में हो सकता है, लेकिन ज़्यादातर महिलाओं को हार्ट से रिलेटेड जो प्रॉब्लम होता है, वो मेनोपॉज़ के दौरान होता है, और फिर वो धीरे-धीरे पोस्ट मेनोपॉज़ के दौरान भी होता है। तो जानते हैं आज थोड़ी बहुत स्टैटिस्टिक्स जो वर्ल्ड वाइड जानी-मानी ये स्टैटिस्टिक्स है। जैसे एक वुमेन्स हेल्थ इनिशिएटिव ऑर्गेनाइज़ेशन है, उनकी स्टडी ने ये पाया है कि पोस्ट मेनोपॉज़ल एज वुमन जो रहती है, वो हाई रिस्क पे होती है कार्डियोवास्कुलर डिज़ीज़ में। और पर्टिकुलरली ऐसी महिलाएँ जो हार्मोन रिप्लेसमेंट थेरेपी को बहुत लंबे टाइम से तक लेती है, यानी कि बियॉन्ड 7-8 इयर्स। यानी कि उन्होंने अपने जीवनचर्या में ही हार्मोन रिप्लेसमेंट थेरेपी को ले लिया है। फिर फ्रेमिंघम हार्ट स्टडी बताते हैं, उन्होंने एक रिसर्च किया है कि लेडीज़ के मेन के कंपेयर में वुमन को ये जो हार्ट प्रॉब्लम होता है, उसका कारण क्या है? तो उसका कारण है, उन्होंने पाया है एस्ट्रोजन लेवल जो हमारे शरीर में पाया जाता है, वो उसका कम होना, और धीरे-धीरे वो डिक्लाइन होके पूरी तरह से बंद हो जाना। आगे मैं बताऊँगी कि एस्ट्रोजन का काम क्या है कार्डियोवास्कुलर सिस्टम में। उसके बाद और एक स्टडी, नर्सेस हेल्थ स्टडी में बताया गया है कि मेनोपॉज़ की एज में जब लेडीज़ को वेट गेन हो जाता है, यानी मोटापा आ जाता है, पर्टिकुलरली अराउंड द टमी, द वेस्ट एरिया, उसकी वजह से कोरोनरी हार्ट डिसीज़ का रिस्क लेडीज़ में बढ़ जाता है, और जब वो ये ध्यान नहीं देती, तो उनको हार्ट प्रॉब्लम स्टार्ट हो जाती है। और जैसे मैंने बताया आपको, एस्ट्रोजन हार्मोन जो हमारी लेडीज़ में मेंसेस को लाने के लिए, हमारी त्वचा को यंग रखने के लिए, हमें खूबसूरत बनाने के लिए, रिप्रोडक्टिव सिस्टम के लिए रेगुलर हमारा जो भी बॉडी का कंपोजिशन है उसको मेंटेन करने के लिए, बोन्स, मसल्स, न्यूरॉन्स उसको एक्टिव करने के लिए, सारे चीजों के लिए एस्ट्रोजन हार्मोन बहुत ही अहम भूमिका निभाता है। लेकिन क्योंकि जैसे मैंने बताया पेरीमेनोपॉज की एज के साथ ही एस्ट्रोजन हार्मोन में थोड़ा डिप्लीमेट स्टार्ट हो जाता है, और उसकी वजह से हमको हार्ट प्रॉब्लम स्टार्ट हो जाती है। अभी एस्ट्रोजन हार्मोन कार्डियोवास्कुलर सिस्टम को कैसे सपोर्ट करता है? तो फर्स्ट ऑफ ऑल कोलेस्ट्रॉल, उसका रेगुलेशन करता है एस्ट्रोजन हार्मोन। ये हमारे अंदर के गुड कोलेस्ट्रॉल को अच्छे से कंट्रोल में रखता है, उसका लेवल एकदम नॉर्मल पर रखता है, और बैड कोलेस्ट्रॉल को कम करने में मदद करता है। अब जब हमारा एस्ट्रोजन हार्मोन कम हो जाता है तो ये बैड कोलेस्ट्रॉल है वो बढ़ता है, और गुड कोलेस्ट्रॉल धीरे धीरे कम होने लगता है, जिसकी वजह से प्लेक का फॉर्मेशन होता है आर्टरीज में। यानी कि आपने सुना होगा डॉक्टर को बोलते हुए कि आर्टरी के अंदर कचरा जमा हो गया है ना? इसलिए उसका जो आर्टरी है ना, उसमें जो कचरा जमा हो गया है उसकी वजह से खून, ब्लड हार्ट तक, और हार्ट से ऑर्गन्स तक नहीं पहुंच पा रहा है, और इसीलिए हार्ट में दर्द हो रहा है। जैसे एक पानी की पाइपलाइन, अगर उसमें कचरा भर जाता है तो हमको कैसे परेशानी होती है, वैसे ही हमारी बॉडी में परेशानी होती है, क्योंकि ऑक्सीजनेटेड ब्लड हर ऑर्गन्स को मिल नहीं पाता है। उसके बाद आर्टरीज, उसकी जो फ्लेक्सिबिलिटी है, जो लचकता है, वो एस्ट्रोजन हार्मोन की वजह से होती है। जब ये कम होता है तो ये जो स्थितिस्थापकता है ब्लड वेसल्स वॉल की, वो कम हो जाती है और वो कड़क हो जाती है, स्टिफ हो जाती है, जिसकी वजह से हमको हाई ब्लड प्रेशर होने के चांसेस बढ़ जाते हैं। और तीसरा बहुत ही इंपॉर्टेंट रोल जो एस्ट्रोजन हार्मोन निभाता है वो है एंटी इंफ्लेमेटरी प्रॉपर्टीज। एस्ट्रोजन हार्मोन में एंटी इंफ्लेमेटरी प्रॉपर्टी है जो हमारी आर्टरीज को, ये जो कचरा है उसको जमाने से बचाता है, उसको जमने से बचाता है, जिसको बोलते हैं हम एथेरोस्क्लेरोसिस, यानी आर्टेरियल वॉल को थिक हो जाना और उसमें कचरा जाम हो जाना। तो ये 3 चीज़ें हैं, वो चीज़ों के ऊपर जो कंट्रोल होता है, वो पूरा चला जाता है। तो ये जो हार्ट डिज़ीज़ है, उसके रिस्क क्यों बढ़ जाते हैं? इसमें हम ज़्यादा, मैं आपको बताती हूँ, ये तो मैंने सिर्फ़ आपको एस्ट्रोजन हार्मोन के बारे में बताया कि उसका जो प्रोटेक्शन है वो कम हो जाता है। दूसरा कारण है एब्डोमिनल फैट डिस्ट्रीब्यूशन। एब्डोमेन में जो फैट डिस्ट्रीब्यूट होता है उसकी वजह से भी एस्ट्रोजन हार्मोन, ये जो अपना ब्लड सर्कुलेशन है वो हार्ट तक अच्छे से पहुंच नहीं पाता है, और आर्टरीज के ऊपर प्रेशर बना रहता है, बड़ी बड़ी आर्टरीज के ऊपर। फिर उसकी वजह से हाई ब्लड प्रेशर हो जाता है, और हाई ब्लड प्रेशर अगेन लीड्स टू हार्ट प्रॉब्लम्स। फिर इंसुलिन रेजिस्टेंस हो जाता है, बिकॉज फैट की वजह से हमारा जो ब्लड है वो अच्छे से हार्ट तक और हार्ट से पेट तक नहीं पहुंच पाता है। इंसुलिन रेजिस्टेंस हो जाता है जो टाइप 2 डायबिटीज और कोलेस्ट्रॉल लेवल को बढ़ाने में पूरा डिस्टर्ब कर देता है लेवल, क्योंकि एस्ट्रोजन अगर इंसुलिन का रेजिस्टेंस आ जाता है बॉडी में तो ग्लूकोज मेटाबॉलिज्म डिस्टर्ब हो जाता है। तो अगेन इनडायरेक्टली इट अफेक्ट्स ऑन योर हार्ट। फिर आपका ब्लड क्लॉटिंग है, उसका वो उसके चांसेस बढ़ जाते हैं, बिकॉज मेनोपॉज लीड्स टू चेंजेस इन ब्लड कोएगुलेशन, और उसकी वजह से भी ब्लड में है जो क्लॉट्स बनना शुरू हो जाता है, और वो क्लॉट्स आपकी जो ब्लड में ना घूमते रहते हैं, और कभी कभी बड़ी आर्टरी में आके वो फंस जाते हैं, जिसकी वजह से स्ट्रोक आने की शक्यता बढ़ जाती है। और कई बार आपने सुना होगा कि सुबह तक तो अच्छी खासी थी, अचानक क्या हो गया, बैठे बैठे अचानक ही हार्ट बंद हो जाता है पंप करना, क्योंकि अचानक ही कोई बड़ा सा क्लॉट आके बड़ी आर्टरीज में फंस गया, और वहां से ब्लड हार्ट तक नहीं पहुंच पाया, जिसको बोलते हैं मायोकार्डियल इंफार्क्शन, सडन हार्ट अटैक, एकदम से हार्ट का काम करना बंद हो जाना। दूसरे कारण है आजकल की महिलाओं में स्मोकिंग फैशन हो गई है ना? तो दोस वुमन हु आर स्मोकिंग, they are the higher risk of having heart disease in their post menopausal age, बिकॉज स्मोकिंग की, स्मोकिंग भी एक कारण है कि आपकी आर्टरी को श्रिंक करता है, ऊपर से आपका एस्ट्रोजन की वजह से भी आर्टरी श्रिंक होता है, तो जो द जो दो दो रीजन जब इकट्ठा होते हैं तो आपको हार्ट अटैक आने के चांसेस बढ़ने लगते हैं। सेडेंटरी लाइफस्टाइल यानी लेक ऑफ फिजिकल एक्टिविटी पोस्ट मेनोपॉजल एज में, क्योंकि कई सारी महिलाओं को एक्सरसाइज करने का पहले से आदत ही नहीं होता है। कई सारी महिला क्योंकि वो मोटी हो चुकी है उनको आलस आती है, और कई सारी महिलाओं ने कभी इन एक्सरसाइज को एक हेल्दी हैबिट के तौर पे नहीं देखा है। तो यहाँ पे वो लोग कार्डियोवास्कुलर डिजीज का शिकार हो सकती है। अनमैनेज स्ट्रेस, आपने देखा होगा आजकल की मॉडर्न महिलाएं जो घर का, बाहर का, ऑफिस का, सब जगह पे उनको संभालना पड़ता है, जिसकी वजह से एक स्ट्रेस उनके ऊपर आ जाती है। स्ट्रेस की वजह से कॉर्टिसोल हार्मोन जो आपकी किडनी है उसके ऊपर एड्रिनल ग्लैंड है, उसमें से एक कॉर्टिसोल हार्मोन निकलता है। जितनी मात्रा में खाने में आपको नमक चाहिए उतनी ही मात्रा में खून में आपके कॉर्टिसोल चाहिए, लेकिन रेगुलर स्ट्रेस की वजह से आपके खून में इसी एड्रिनल ग्लैंड से कॉर्टिसोल हार्मोन बढ़ता जाता है, बढ़ता जाता है, बढ़ता जाता है, एंड दैट अगेन लीड टू हाई ब्लड प्रेशर और आर्टरी में श्रिंकेज होना, इन्फ्लामेशन बढ़ना, और सारी ये अनहेल्दी हैबिट्स, इमोशनल ईटिंग बिकॉज ऑफ स्ट्रेस, it leads to obesity, obesity again lead to insulin resistance। सो एक साइकिल बन जाती है ना? एक स्ट्रेस की वजह से आप समझ सकते हैं कितनी एक साइकिल हो जाती है, एंड दैट एंड ऑफ दैट साइकिल इज क्रोनिक कार्डियोवास्कुलर प्रॉब्लम। फिर जेनेटिकली ऑल्सो कई महिलाओं में ये फैमिली हिस्ट्री होती है हार्ट डिजीज डेवलप करने की, जो पोस्ट मेनोपॉजल एज में बढ़ जाती है। ठीक है, तो मैं फटाक से बता देती हूँ आपको क्या सिम्टम्स होते हैं पोस्ट मेनोपॉजल एज में। अगर आपको ऐसा लगता है कि लक्षण क्या होते हैं, तो सबसे पहला हम सब जानते हैं चेस्ट पेन, इसको बोलते हैं एंजाइना। अब ये एंजाइना है वो आपको नहीं यहाँ पे सिर्फ नहीं फील होता है, कई कई महिलाओं को लेफ्ट शोल्डर में पेन होने की तकलीफ होती है, जो शोल्डर में जो पेन होता है वो उंगलियों तक जाता है। कई महिलाओं को बैक पेन की शिकायत होती है लेफ्ट साइड पे, कई महिला को नेक से लेके यहाँ तक पेन होता है, उंगलियों तक पेन होता है। फिर थकान लगना, ऐवे ही कुछ भी काम ना करे बगैर भी थकान करना, आलस आना, डेली एक्टिविटी में से रस इंटरेस्ट उड़ जाना। फिर थोड़ा बहुत स्टेयरकेस चढ़े, 2 या 3 स्टेयरकेस चढ़े और तो साँस फूल जाना, डिफिकल्टी इन ब्रीथिंग, रेगुलर एक्टिविटीज करने में भी थकान लगना। कहीं-कहीं महिलाओं को नोशिया यानी कि वॉमिटिंग जैसा फील होना, और तब वो समझते हैं शायद कुछ ना खाने में आ गया होगा या फिर मैंने कुछ बाहर का खाया इसलिए वॉमिटिंग जैसा होता है। और कई महिलाओं को चक्कर की परेशानी होता है, यानी आँख के आगे अंधेरा आ जाना। तो समझिए अगर इनमें से 2 या 3 सिम्पटम्स आपको फील होते हैं, तो यू शुड गो फॉर योर जनरल फिजिशियन फर्स्ट ऑफ ऑल, एंड देन टेक केयर ऑफ योर हेल्थ बिकॉज़ प्रिवेंशन इज़ बेटर देन क्योर। ऑलवेज़, ऑलवेज़ रिमेंबर दिस। अब इन ये तो हो गया कि आपने अपना ध्यान नहीं रखा तो क्या सिम्पटम आया और क्यों आया। आप जानते हैं कि अगर इसको प्रिवेंशन इज बेटर देन क्योर जैसे मैंने बोला आपको, तो हम इस लक्षण को आने से पहले भी खुद को इससे निजात पा सकते हैं। कैसे? तो सबसे पहले आपका जो बॉडी वेट है उसको मेंटेन रखिए, आपकी हाइट के अनुसार आपका बॉडी वेट होना चाहिए। सो वेट मैनेजमेंट इज द की टू रिड्यूस द हार्ट डिजीज, यानी आपको डाइट और एक्सरसाइज के माध्यम से आपके वेट को मैनेज करके रखना है। दूसरा है रेगुलर एक्सरसाइज करना, एटलीस्ट एंगेज योरसेल्फ 30 मिनट्स अ डे, मॉडरेट टू हाई इंटेंसिटी एक्सरसाइज, जुम्बा है, कार्डियो एक्सरसाइज है, फिर आप टबाटा कर सकते हो, एचआईआईटी कर सकते हो, वॉक पे जा सकते हो, योगा कर सकते हो, बहुत सारी एक्सरसाइज के फॉर्म है। अगर स्मोकिंग और अल्कोहल का आदत है, प्लीज प्लीज क्विट इट। देन यू शुड मैनेज योर ब्लड प्रेशर एंड कोलेस्ट्रॉल, डेली रेगुलर आपका हार्ट ब्लड टेस्ट का चेकअप करना है। हेल्दी डाइट को करिए, फ्रूट्स, वेजिटेबल्स, होल ग्रेन्स, लीन प्रोटीन्स, इन सारी चीजों को आपके खुराक में ज्यादा से ज्यादा प्लेस दें। बाहर का खाना जितना हो सकेगा प्लीज प्लीज कम कर दीजिए। और सबसे इम्पोर्टेंट चीज, हमेशा आपको खुश रखिए, अपने आप को खुश रखिए, मेनोपॉज से डरिए नहीं। स्ट्रेस आता है सबको, लेकिन उसको डीप ब्रीदिंग टेक्निक से आप कम कर सकते हो। और दूसरा, सबको माफ करे। ये सबसे बड़ा रामबाण इलाज है आपके स्ट्रेस का। सारी लाइफ सिचुएशन को, खुद को और आपकी जिंदगी में जो भी व्यक्ति है जिनसे आपको स्ट्रेस होता है, उन सबको माफ करें। फॉरगिव एंड फॉरगेट। सो क्या आपको मैंने गोल्डन रूल दिया? इफ यू वांट टू स्टे हेल्दी एंड फिट एंड डोंट वांट टू गेट एनी कार्डियोवास्कुलर रिस्क इन योर लेटर एज, start forgiving yourself, other people, and your life situation, and forget all the past hurt and trauma which you have experienced in your life. तो ये हो गया आपका हार्ट से रिलेटेड जो भी प्रॉब्लम्स होती है उसका कॉज हो गया। अब आपको मैं बताने चाहती हूँ ब्रेस्ट कैंसर और मेनोपॉज का रिलेशनशिप। So menopause also has profound effect on your breast tissue, and the risk of breast cancer increases with the age. No matter आप कौन से सिटी में रहते हो, दुनिया के कौन से कोने में रहते हो, all over the world, it has been found that one out of every 7 women have tendency to develop breast cancer. Remember this, one out of every 7 women. And we all know it happens first and foremost because of the hormonal changes which is happening in your menopausal age. Then your breast tissue की density होती है, उसमें भी changes आते हैं, cells में changes आते हैं, and obviously estrogen level में जो डिक्लिनेशन होता है, जो कम होता है एंड देन वो स्टॉप हो जाता है, इसकी वजह से आपका ब्रेस्ट कैंसर होने के चांसेस बढ़ जाते हैं। तो यहाँ पे रिसर्च क्या बोल रहे हैं? रिसर्च बोल रहे हैं देयर इज अ सिग्निफिकेंट लिंक बिटवीन प्रोलॉन्ग्ड यूज ऑफ एचआरटी विद एन इंक्रीज रिस्क ऑफ हार्मोन रिसेप्टर पॉजिटिव ब्रेस्ट कैंसर। अब यहाँ पे मैंने बोला एचआरटी, लेकिन एचआरटी को कैसे ले रहे हो, कितना टाइम से ले रहे हो, और उसके जो आपके जो उसका साइड इफेक्ट क्या है, उसका बेनिफिट क्या है, आप किसकी अंडर इंस्ट्रक्शंस ले रहे हो, ये सारी चीजें मायने रखते हैं। ठीक है। देन और एक रिसर्च में पाया गया है कि अगर वो जो एचआरटी आप ले रहे हो, वो अगर इस्ट्रोजन प्रोजेस्टेरोन कंबाइन थेरेपी है, तो एस्ट्रोजन में फॉरेन एक पर्टिकुलर एस्ट्राडायम करके एस्ट्रोजन रहता है। वो जो मॉलिक्यूल है एस्ट्रोजन में, उसका ज्यादा प्रमाण में लेने की वजह से आपको ब्रेस्ट कैंसर होने की शक्यता है। लेकिन सिर्फ और सिर्फ एचआरटी जिम्मेदार नहीं है ब्रेस्ट कैंसर के लिए। मैं आपको आगे बताऊंगी कि कितने सारे फैक्टर्स एक साथ काम करते हैं, तब जाके आपको ब्रेस्ट कैंसर हो जाता है। राइट? So why this breast cancer risk increases after menopause? ऐसा क्या चीज है, वो मैं आपको स्टेप बाय स्टेप बताती हूँ। तो यहाँ पे भी पोस्ट मेनोपोजल वेट गेन इज वन ऑफ द कल्प्रिट to give you the disease related to your breast. So excess body fat produces estrogen, and higher level of estrogen in your postmenopausal age that can contribute to development of the breast cancer. हमारे जो फैट सेल्स है वो भी एस्ट्रोजन हार्मोन करते रहते हैं सीक्रेट, क्योंकि जब ओवरी काम करना बंद करती है, लेकिन एस्ट्रोजन तो बॉडी के लिए चाहिए, तो थोड़े समय तक हमारे बॉडी में फैट सेल्स होते हैं जो एस्ट्रोजन सिक्रेट करते हैं, जिसकी वजह से ब्रेस्ट कैंसर होने की शक्यता बढ़ जाती है। देन डिलेड सेल्युलर टर्नओवर, यानी कि विद द एज द बॉडीज एबिलिटी टू रिपेयर एंड रीजनरेट सेल्स इट बिकम स्लो डाउन, है ना। प्रोग्रेसिवली जो सेल हमारे बॉडी के अंदर 15 दिन में, 20 दिन में या 1 महीने में चेंज होते थे, वो 2 महीने में, 3 महीने में खराब सेल्स चेंज होते हैं और नए सेल्स रीजनरेट होते हैं। और उसकी वजह से जो खराब सेल है, कभी कभी उसका ग्रोथ बढ़ जाता है। तो कैंसर यानी क्या, ट्यूमर यानी क्या, हमारी ही बॉडी के सेल हैं जो टॉक्सिक बन जाते हैं हमारी बॉडी के लिए, और वो सारे सेल एक झुंड जैसा बन जाते हैं जो हमारी बॉडी के अगेंस्ट काम करते हैं, जिसको हम ट्यूमर बोलते हैं, है ना, जो हमारी बॉडी के अपोज में काम करते हैं, और हमारी बॉडी उसको एक फॉरेन बॉडी समझ के फिर रिएक्ट करती है। तो इट दिस काइंड ऑफ थिंग इज आल्सो may result in the cancer. Then जैसे मैंने आपको बोला प्रोलॉन्ग यूज ऑफ एचआरटी, Then family history. Yes, women with family history of breast cancer, there's a kind of genes they have found out in the woman having this breast cancer. They are at the high risk, but that doesn't mean that that woman, if she follows all the criterias of healthy lifestyle, she may not develop the breast cancer. तो डरना नहीं है कि मेरी फैमिली में दादी को था, नानी दादी को था या नानी को था, फिर मम्मी को हुआ, यानी मौसी को हुआ तो मुझे भी हुआ। नो, if you follow, if you take care of your health from the perimenopausal age, you will certainly not get breast cancer in any till you die, right? Then what are the additional cause of your breast cancer after menopause? और कौन से कॉजेज है? और ये तो प्राइमरी रीजंस हो गए ना। दूसरे क्या है? अल्कोहल कंजप्शन। सो ड्रिंकिंग अल्कोहल इज आल्सो द नोन रिस्क फैक्टर फॉर योर ब्रेस्ट कैंसर। द मोर अल्कोहल यू consume, there is more insulin resistance, more fat deposition, and all the metabolism of your body it gets affected. Liver cirrhosis हो जाना, fatty liver हो जाना, and ये सारा जो साइकिल है इट इवेंचुअली अफेक्ट्स योर ब्रेस्ट टिश्यू. Then late menopause. So the woman who ever experienced menopause after the age of 55, they have had a long exposure to estrogen. जैसे मैंने आपको पहले पॉइंट में बताया कि एस्ट्रोजन को सिक्रेट करते हैं फैट सेल्स. तो जो लेडीज लॉन्ग टर्म उसके बॉडी में नेचुरली जो एस्ट्रोजन सिक्रेट होता ही रहता है, जिसको लेट मेनोपॉज आता है आफ्टर द एज ऑफ 55 या 60, they are having greater risk of developing this breast cancer, right? और सबसे इम्पोर्टेंट जो मैंने लास्ट में हार्ट प्रॉब्लम्स में बताया था वो यहाँ पे भी बोलना चाहूंगी. प्रोलॉन्ग्ड हर्ट, गिल्ट, नॉट एबल टू forgive people who did wrong with you, stress, overthinking, anxiety issues, panic attacks, depressions, all are also the important factors which are leading you away from your health and near to this breast problem, breast cancer. So be aware of your mind and body, both the changes at your body and changes at your mind. It will happen, but you need to be mindful. What kind of issues going on in my life? For that, you need to mindful. Right? Then what are the symptoms? So every woman who comes to my clinic, I tell them every year you need to go for mammography and USG breast, no matter कोई सिम्टम है कि नहीं. सिम्टम कौन से आते हैं? तो फर्स्ट आपको लंप जैसा फील होता है ब्रेस्ट में, जो वैसे तो पेनलेस होता है, बट वो ना ब्रेस्ट टिश्यू से अलग फील होता है. ऐसा लगता है जैसे कुछ कड़क पार्ट है वो ब्रेस्ट टिश्यू के साथ हिलता है व्हेन यू पाल्पेट द ब्रेस्ट. देन नीपल से डिस्चार्ज आना शुरू होता है, जो फ्लूइड जैसा होता है, पस जैसा रहता है, कभी-कभी ब्लड जैसा रहता है और उसमें से स्मेल भी आता है. As if when you are breastfeeding your infant, you remember some kind of milk के पहले थोड़ा सा कुछ फ्लूइड आता है, ऐसा ही कुछ स्टिकी फ्लूइड आता है. Then changes in your breast appearance. There may be swelling, with dimpling. जैसे ऑरेंज कैसा रहता है? ऑरेंज का सीन मालूम है? ऑरेंज का जो छिलका होता है, उसका जो स्किन होता है कैसा होता है ना, थोड़ा-सा खड्डा, थोड़ा-सा प्लेन, उसको डिम्पलिंग बोलते हैं. ऐसा कुछ ब्रेस्ट टिश्यू देखना शुरू होता है. फिर एक्जिला में भी किसी-किसी को स्वेलिंग जैसा होता है, क्योंकि यहाँ पे एक्जिला में लिम्फ नोड्स होते हैं. वो भी उसमें भी सूजन आ जाता है. स्किन चेंज हो जाती है ब्रेस्ट की, थोड़ी रेड हो जाती है, थिक हो जाती है. यू नो सो दीस आर सम विजिबल चेंजेस यू कैन सी ऑन योर ब्रेस्ट. तो हर एक लेडीज को इसका अपने घर पे भी फिजिकली पाल्पेट करके वो चेक कर सकती है कुछ ब्रेस्ट में चेंजेस देखने. इफ शी फील शी कैन गो एंड डू दिस मैमोग्राफी एंड देन शी कैन आल्सो डू यूएसजी सोनोग्राफी. Then how you can prevent the breast cancer after menopause? तो सबसे पहले, जैसे मैंने हार्ट की प्रॉब्लम में बोला, रेगुलर स्क्रीनिंग करना है. जैसे मैंने बोला एनुअल मैमोग्राम्स एंड क्लिनिकल ब्रेस्ट एग्जाम्स which are crucial for every woman. मेंटेनिंग हेल्दी वेट, जैसे हार्ट हार्ट की इश्यू में बोला, यू हैव टू मेंटेन योर वेट विथ योर एक्सरसाइज एंड फूड इनटेक, limit alcohol consumption, exercise regularly, and consider alternative to HRT. अगर आपको लगता है कि HRT लेने से इश्यू आ रहा है या आपको डर लग रहा है, तो there are non-hormonal therapies also to manage your menopausal symptoms. So you can always talk to a menopause specialist or a healthcare provider who can help you to prevent these menopausal age problems. सो लास्ट बट नॉट द लीस्ट, मुझे आप सबको यही बताना है कि मेनोपॉज प्लेज सिग्निफिकेंट रोल in increasing the risk of both cardiovascular disease and breast cancer. While these risks are concerning, they can be managed. Remember, they can be managed through early detection, lifestyle changes, appropriate medical intervention as in when it's needed.
Mhm.
So, ये तीन चीज अगर आपने कर ली, so you are good to go. You can have a beautiful post-menopause life, healthy, active, and remember, there is no pause in your joy, no pause in your excitement, no pause in your any kind of activity, no pause in laughing, no pause in feeling good, no pause in anything. There is only and only pause in your regular, daily, monthly menstrual cycle. So, with that, I'm concluding my session, and I hope I have give you a somewhat clarity. And if you have still any question, write in the comment box, and I'll give your answer. Thank you so much for listening me, and thank you so much for taking care of your health. Because unless and until you have not taken care of your health, you are not here today. Thank you so much.
Thank you, Dr.
Yes.
Purvi, for such an elaborative talk on कैसे heart no is like heart disease is related to menopause and post menopausal problem, and कैसे breast cancer it has been so much crucial. और दुनिया में दो ही कैंसर है जो सबसे ज़्यादा पाए जाते हैं, खास करके इंडिया में, दैट इज ब्रेस्ट कैंसर एंड सर्वाइकल कैंसर.
Yes.
वी आर रनिंग फास्ट टूवर्ड्स इट. और इसमें ये सारी जानकारी मैं मानती हूँ सभी के लिए बहुत ही लाभदायी रहेगी कि कैसे इन दोनों चीज़ों से मैनेज किया जाए. पर मैं थोड़ा डर भी गई हूँ सारा कुछ सुन सुन के कि ऐसा सब भी होता है मेनोपॉज की वजह से. सो आई एम श्योर काफ़ी लोगों को लग रहा होगा कि ये तो बहुत खतरनाक चीज़ें हैं. सो वी वुड ऑल्सो लाइक टू हैव more tips on it. So let's go with our next expert, Dr. Monali, who is going to let us understand कि हम फिजिकल कंपोनेंट को कैसे संभालें, कैसे हम फिजिकल एक्सरसाइजेस को इंक्लूड करें, क्या मात्रा में इंक्लूड करें, उससे हमारे शरीर को क्या लाभ होगा जब हम वो एक्सरसाइजेस को इंक्लूड कर रहे हैं. आई कैन सी एक दो क्वेश्चंस हैं कमेंट बॉक्स में. प्लीज हैव पेशेंस, हम लोग ज़रूर से आपके क्वेश्चंस लेंगे एट द एंड ऑफ ऑल आवर एक्सपर्ट टॉक्स. Experts will pick up your question and they will definitely give you the answer on it. And before we switch on to Dr. Monali, हमारे तीसरे एक्सपर्ट एवरिल हैज अराइव्ड. तो मैं उन्हें स्क्रीन पे वेलकम करना चाहूँगी और उनके बारे में सभी को इंफॉर्मेशन देना चाहूँगी. Good evening, Avril. Welcome to the session. We are very glad to have you today on Rutuja's platform. You're mute.
Sorry, I'm very happy to be here. Thank you.
Yeah, same here. We really look forward to the demonstration of the poses जो आज आप देने वाली हैं. दर्शकों के लिए एक छोटा सा एप्रिल को लेके इंट्रोडक्शन दे रही हूँ. She is an experienced life architect, a multi-functional therapist, and an ICF PCC coach specializing in helping individuals unlock their full potential through a holistic approach. With extensive expertise in Kundalini Yoga, alternative therapies, and coaching, she guided countless individuals towards hormonal balance, stress relief, and deep emotional healing, which is what we usually don't talk. हम लोग इमोशंस के बारे में सबसे लास्ट में कभी बात नहीं करते हैं। सो शी डील्स विद द इमोशंस। सो जो लोग हमें सुन रहे हैं, अगर आपको कुछ भी भावात्मक क्वेश्चंस हैं, इमोशंस को लेके कुछ डिस्टर्बेंसेस हैं, ट्रॉमा को लेके, प्लीज स्टार्ट pouring your questions in the comment box. Avril is going to sort them out here with you. Through her flagship programs like Mind Your Mind, Shakti, she has transformed lives of CXO leaders and many other individuals by enhancing well being and fostering profound inner growth, which is again a missing factor in female life. Because most of us, we live for others, हम लोग भूल जाते हैं कि हमें पहले हमारे लिए भी जीना है। तो शी वर्क्स एट द कोर लेवल फॉर ऑल ऑफ दिस थिंग्स, और आई एम श्योर आज उनकी विजडम और जो टेक्निक्स वो हमें देंगी, उससे हमें काफ़ी लाभ होगा और हम लोग काफ़ी कुछ नो इसमें और कर पाएंगे। सो वंस अगेन वेलकम एवरिल। We would be happy to hear you once Monali finishes her presentation. So let's share Monali's PowerPoint, and Monali, you can please go ahead.
Sure. Thank you, Dr. Nehal, for having me here on the panel today. First of all, a very good evening, and all you beautiful women out there. Wishing you all a very happy World Menopause Day. I am Dr. Monali Khanvi, a physiotherapist. Today, I'm going to talk about how we stay active through menopause. So, let's go, let's start. So, first of all, thank you, Dr. Purvi, for such an insightful knowledge on what menopause is. So, just a little brief about it. Menopause, जैसे Dr. Purvi ने कहा, is a natural process in which the estrogen level in the body reduces. It is a part of aging and it marks the end of women's reproductive system. So, हम बहुत बात करते हैं about estrogen. So, what is actually estrogen? Estrogen is one of the hormones which is secreted by our ovaries, which also helps in regulating our menstrual cycle. So, from the time a girl starts getting their menses till the age of around 40-45 years, estrogen helps in our regular monthly cycles of periods. So most common age of menopause जो research के हिसाब से in Indian population है is around 45 to 55 years of age. This is the age group where a woman starts getting alternate monthly periods, or they start getting reduced cycles of periods in their month. Okay, so now Dr. Purvi just explained and enlightened us about effect of menopause on heart and on breast. Let's see what it does on human bone and human body. So first of all, menopause, there are few effects which happen on bones. That are, it could cause osteopenia, osteoporosis, osteoarthritis, urinary incontinence, it can cause obesity, weight gain, it changes mood, there are mood swings, anxiety, and of course there are hot flushes. So on your right, you can see a lot of symptoms, but I have just highlighted the most common ones. Now we know everybody talks about 45 years के बाद सबको knee pain होता है, back pain होता है, सबको arthritis हो गया है. And as we all know, women are more prone for arthritis than males. So why does this happen? Estrogen, as we know, also helps in stimulating calcium, and it from the calcium causing cells, estrogen helps in stimulating and releasing hormones, calcium, that goes to the bone, which makes our bones stronger. But as we know, menopause पे estrogen level reduces, and hence calcium इतना secrete नहीं होता है, so that your bone starts getting softer and weaker. And that's why women are more prone for osteoarthritis than males. The second most common effect of menopause on women is urinary incontinence. जैसे we all know, our mothers, our sisters who are in that age group of 40 to 45 or 45 to 50 years, they sometimes complain कि उनको coughing पे, sneezing पे, urine leakage होता है, या फिर they have that urge to go to washroom every 10 minutes. That feeling is known as urinary incontinence, जो जो ईस्ट्रोजन कम होने की वजह से भी होता है. Other very common cause is obesity. We know women complain that after menopause they've started gaining weight. Even if they don't eat much, they still start gaining weight. This is again directly related to reduced estrogen level in the body. Also, the complaints are anxiety, mood swings, and of course, hot flushes. So, how do we deal with all of these? And how does physiotherapy help in this conditions? So, what happens is exercising regularly during your menopause or staying active, it helps in preventing your bone density loss. Now, how does it prevent bone density loss? Like, as in when we exercise, more estrogen is secreted from the ovaries, and in turn, it helps in also producing more calcium, which goes to the bone, and that helps in reducing the weakening of your bones or stopping your bones from getting weaker and softer. Now, जैसे ही bone density loss कम हो गया, in turn it helps in reducing your osteoarthritis and osteoporosis. And exercising regularly also secretes the happy hormones in the body. So what happens because of that is it helps in boosting up your mood and it reduces your anxiety. And all of this in turn will definitely help in improving your mental health and it helps in improving the sleep. So, ladies, on your right, as you can see, we can be gorgeous at 30, we can be charming at 40, and we definitely can be irresistible for the rest of our lives. Okay, now moving forward, let's see how the low impact exercises that should we do during menopause will help us in achieving our goals and take our menopause journey very beautifully. So the most common problem that our patients come across is the urine leakage. So the best exercise for preventing the urine leakage is Kegel's exercises. So why does this urine leakage happens? And what happens when there is a urine leakage? So basically, we all know we have a pelvic girdle. In that, we have muscles that helps in strengthening our pelvic, that helps in strengthening and protecting our organs inside the body. Those are uterus, our vagina. All of those, our main organs, are supported by the pelvic muscles. Now, pelvic muscles are the muscles which are around your private part. That helps whenever we go to urinate or whenever we go and have our feces. So now what happens when we age and when there is reduced estrogen in the body, our muscles starts getting weaker and weaker. So these pelvic floor muscles, once it starts getting weaker, we start getting the symptoms of urinary leakage or the feeling of going to the urine very often. So, just to strengthen the pelvic floor muscles, there are a set of exercises called as Kegel's exercises. Now, what does this Kegel's exercises do? It helps prevent your urinary incontinence or urine leakage by strengthening the pelvic floor muscles. Now, for how long should we do it? So, the dose of Kegel's exercise is for 3 to 5 seconds to begin with, and then relax for 3 seconds. We have to repeat these exercises for 10 cycles in the morning and 10 cycles in the evening. Now, as you can see in the image below, there are steps written over here. I will also demonstrate on how to do the Kegels exercises, but let me just first read here on the picture. So the first picture tells us the position of our Kegels exercises. So the position first is we need to lie down straight, feel your pelvic floor muscle. Once you know that your posture is correct, the next step is you have to suck in your pelvic floor muscle. Imagine you're pulling your private part inside, or you can also imagine that while urinating, you are just stopping the urine for that first 3 seconds. That should be the feeling. The next step is hold that position for 3 seconds and then release it for 3 seconds again. Now continue and maintain this cycle for 10 times. Let me just demonstrate on how to do it. Okay, so first of all, just take a mat or the bed. I want you all to lie down straight on the mat. Bend your legs like this and keep your hands on your stomach. Now locate your pelvic floor muscles. So pelvic floor muscles are the muscles that help when you urinate. So now this, our private part, is our pelvic floor muscles. Now I want you all to feel the private part and suck in the pelvic floor muscle. Suck in your muscle. Pull your stomach up. Feel it at the belly. Now hold this position for 3 seconds. 1, 2, 3, and then release for 3 seconds. Then repeat again. Suck in your stomach. Hold it for 3 seconds. 1, 2, 3, and relax. So we repeat this for 10 cycles. So we repeat this for 3 cycles. I hope I was visible.
Yes, yes.
Okay. The second best exercise that we can do is pelvic bridging. Okay. So now what are the importance of pelvic bridging is one, it activates our pelvic floor muscle. Second, it increases the mobility of our pelvic girdle. Third, it helps in reducing the pain. And fourth, it helps in strengthening the muscle. So, how do we do the bridging, pelvic bridging exercises? Is again, let me demonstrate this. Yeah. So, to do the pelvic bridging, we need to lie down again. Keep your legs bent. I want you to keep your hands by your side. Now, suck in your tummy and lift your back up. Hold this position for 5 seconds. 1, 2, 3, 4, and 5. And then slowly reduce it down again. We repeat this for 5 times. Again, suck in your tummy and lift up your back. 1, 2, 3, 4, and 5. And we lower this down. Okay. So, what are the importance or the benefits of doing this pelvic floor exercises? First, it prevents your pelvic floor muscle prolapse. Second, it definitely helps to treat your urinary incontinence. Third, it makes the childbirth very easy. Fourth, it helps in strengthening the pelvic floor muscle and it supports your uterus, your vagina for the baby while you're pregnant. Now, next, strength training. As we all know, and as Dr. Purvi also mentioned, that during menopause, women start losing their muscle mass, their bone strength. Now, what can we do to prevent the osteoarthritis and osteoporosis, that is weakening of your bones? Strength training. The best way to prevent losing your muscle mass and losing your bone strength. So I purposely have not shown any exercises for strength training because every woman's body is different. And for every different woman, I have to tailor make the program or the exercises based on their requirements and based on their strength and needs. But in strength training, what all we can include? We can include weights, We can include body weights, we can include TheraBands, and we can include the gym machines. Yes, we definitely can include the gym machines only under an expert's supervision. Now, how does weight training helps women, especially after the age of 35 to 40 years, in preventing the loss of their muscle mass and weakening of the bones? First of all, weight training keeps your bones stronger and healthier. Second, it prevents you from getting any further diseases. How it prevents metabolism, and it boosts metabolism, and it reduces fat loss. Second, it regulates your insulin and lowers the inflammation in the body. Next, it improves the strength and it improves your endurance. Next, it improves your balance and your confidence. So, strength training is tailored from individuals to individuals based upon the symptoms of their menopause. Okay. Last but not the least, aerobic exercises. Aerobic, as Dr. Purvi rightly mentioned, that weight gain directly is proportional to the issues in the heart. That is your cardiovascular system. Now, how do we prevent problems into our heart and the cardiovascular system through exercises? So aerobic exercises, how does it help? What all exercises comes under aerobic exercises? So the first one, that is brisk walking. I request every woman, whether they are in 20s or 30s or 40s or 50s, please take out at least 20 minutes through in your day for walking. Please go and do brisk walking for 15 to 20 minutes and then gradually increase it for 30 to 45 minutes. What brisk walking and swimming does is it improves your cardiovascular endurance by increasing the blood supply to your body. So when you walk, your calf muscle in the leg, which is also considered as our second heart, starts pumping the blood more, which pushes the blood more from your lower body to the upper body, and it helps in pumping the blood more, which reaches your heart, and from there it circulates throughout the body. So it directly helps in improving your heart health. So please, all you beautiful women, please go out there and have 30 minutes for yourself, whether you're in your premenopause or your menopause or your postmenopause period, and just do brisk walking if you don't end up having time for other exercises. And lastly, we have yoga, which is also in the aerobic exercises. But I'm sure we have our next beautiful speaker who will enlighten us about yogas more than I can. So thank you so much. Thank you for having me here. And I hope I could help a little. And I hope you remember me when you go through your menopause happily. Thank you.
Yeah,
Thank
thank you
you.
so much, Monali. It was really very concise and very, precise in terms of beautiful exercises, and also those demonstrations were really good. I'm sure the people here are going to take advantage of it, and we really understand that why exercises and yoga and aerobics are so important, especially the Kegel exercises, because nobody teaches Kegel exercises like this the way you demonstrated today. So a special thank you on that note. And now is the time to friends hear our third expert. So let me call in Avril. Avril, the floor is all open for your demonstration. So Monali has done the platform ready for you. People are now like, okay, we want to understand more how to help ourselves. Now, Purvi has given a good overview of menopausal issues, and practically she has scared me. So we look forward to the treatment and the tips from you how to manage menopause. So please go ahead. Let us know what can more be done in this particular phase to help oneself?
Thank you very much. So, first of all, I'd like to thank Dr. Monali and Dr. Purvi for such enlightening sessions. And thank you, Dr. Nehal, for creating this platform so that we can empower women and allow them to go through the next precious phase of their life, perimenopause and menopause, with a lot of grace and strength. So, Atma Namaste, everyone. And thank you for taking the time to come here and to invest in your health and well being. So, I'm just going to jump straight into it because I want to keep enough time for question and answers.
Yeah,
Because only when you get your questions answered, only then it will make sense, right? So, luckily, you've already understood what is perimenopause, what is menopause. And Dr. Purvi has spoken very well about the different kinds of therapies that you can avail, whether it's HRT, whether it's natural hormonal balancing, whether it's the kind of foods you eat. So she has spoken about a lot of things, and Dr. Monali has also told you what are Kegel exercises, what are bridge exercises, and given you a very good demonstration. So I'm not going to repeat that, but I'm going to basically form a link between all three of what we are talking about. Okay. So the main thing that I want to stress about menopause and perimenopause is that number one, nobody is talking about it, especially in India.
yeah,
Even in the West, because of people like Oprah Winfrey and Michelle Obama, people started talking about menopause to give women a break during their corporate career, just like you would give a person maternity leave. Before that, if you go to any gynecologist, I think Dr. Purvi and I have had a discussion on this. When you go to a gynecologist and you say that I'm feeling depressed, I'm feeling irritable, I'm putting on weight on my belly, my muscles are breaking down, I don't feel good, I have a lot of anxiety, I'm feeling sad all the time. So these are the symptoms. The gynecologist will say, ये तो हम सबके साथ हुआ है, अभी आप थोड़ा सा adjust कर लो. अभी आप पेरीमेनोपॉज में है, आप मेनोपॉज में है, आप एडजस्ट कर लो. अभी क्या है, ये तो होता ही रहेगा ना, अभी 5 साल से आपको एडजस्ट करना पड़ेगा. And some gynecologists will put you on the pill. Some of them will give you antidepressant medication. So I want to tell women that you have every right to go to a gynecologist, and if that person is not able to help you, please seek alternate treatment. I don't believe that any woman should be adjusting. We don't tell men adjust. So why are people telling us to adjust? Because we are mothers, sisters, daughters, caregivers, and everybody depends on us. So when people are telling us to adjust, if the role was flipped and we told a man to adjust, एक दिन भी बर्दाश्त नहीं होगा उनसे. So you have to be your own caregiver. Okay, you have to take care of yourself. So there are many things that you can do and that you should do. So let's understand from a mental and emotional state what is happening to women. So both the doctors before me have very clearly stated that when you are in perimenopause, which is now happening even at the age of 35, because
yeah,
a lot of toxins in the food, in the environment. There are a lot of toxins, in our bodies through antibiotics, through even taking the pill for a long period of time, because we need to understand that there is a difference between progesterone and progestins. Progestins is not a bioavailable hormone, it is a chemical. And in the 90s, in the 80s, the women, in the 90s, sorry, the Women's Health Initiative, they tested progestins on women. And that's why some women developed cancer. So HRT was banned. But I want to tell you that HRT can be a game changer for you if you are the right candidate. Okay? So I'm just going to stop there. And because Dr. Purvi is the expert. I have also dealt with many women who take HRT in my yoga class, in my one to one coaching, and their lives have changed. But you have to check for cancer in your family, especially breast cancer. You have to check what is the age that you're starting. Taking HRT after menopause is a waste of time. If you're starting HRT, it should be in perimenopause. Okay. So, what is happening to the woman? She's losing progesterone, she's losing estrogen, she's losing testosterone. Now, very few women know that we make more testosterone than men. Yeah, we make more testosterone than men, but we make it only for 2 or 3 days in the cycle. Men are making testosterone every half an hour. That's why. So, when the testosterone is going down, estrogen is going down, progesterone is going down, what is happening? Like the doctors explained to you before, you're mentally and emotionally and physically imbalanced. So, how does that show up in your life? You might get heart palpitations. You might get irritable. You might constantly be worried. You might get panic attacks. You may get stress attacks. You may not be able to get up from your bed. Your clothes may not fit you. Now, all this is compounding because when women look in the mirror, we are taught that our self esteem depends upon what we see in the mirror. If you look at yourself and you stand on the scale and you've put on 1 kilo, how many of you say, no, it's okay. I'm going through perimenopause. It'll happen like this. My water is retaining, or my body is retaining water. It'll be okay. No, we don't do that. Arey, ye kya ho gaya? You start being mean to yourself. You start judging yourself. So I want to explain that perimenopause and menopause are as special as you would have gone through puberty or your first child. These are all phases in a woman's life where you have to embrace who you are. You have to embrace that Shakti or that power within you. So, what is Kundalini Yoga? Let's understand. As our hormones are decreasing in perimenopause, let's talk about perimenopause because that's when you need to be aware, is this happening with me? So, as the hormones are decreasing in perimenopause, it's taking a toll on the pranic energy in the body. So we all are born with what Chinese call chi, or what Sanskrit scriptures call prana, or in Kundalini Yoga, it's called Kundalini Shakti. It's all the same. It's prana. Okay. Now, when your hormones are decreasing, it is taking a direct toll on the pranic body, which means estrogen is supposed to be a hormone of growth. Okay. Progesterone is supposed to be a calming hormone, and testosterone is supposed to be a hormone of vitality in very simple terms. Okay. I don't want to complicate this because we are all not doctors. Now, when the pranic body is affected, we have to understand that in yoga, we don't just have one physical body. In Kundalini Yoga, we are taught that we have 6 energy bodies, 3 mental bodies, and 1 physical body. And the other 9 bodies are manifesting their symptoms in the physical body. So, example, if you have a simple migraine, that means number one, the Agnya chakra is impacted. Okay. The entire mental body is now going into what we call the negative mind. So, let me first explain the 6 bodies. So we have 6 energy bodies: the pranic body, the radiant body, the soul body, the arc line, the halo, and the pranic body. So we have 6 bodies. And the mental bodies are the positive mind, the negative mind, and the neutral mind. And then we have the physical body. So the mental bodies are positive and negative. So when people are very optimistic, they're operating more from their positive mind. When people are negative, they're operating more from the negative mind. When people can balance both these minds, not overly pessimistic and overly optimistic, they are in the neutral mind. That's where we want to operate, in the neutral mind. But the neutral mind cannot function if there is imbalance in the Agnya chakra, because the pineal gland, which is in the center of the head, and the pituitary gland, which is in the base of the spine, which are master glands in the body, are not able to function properly because the endocrine system has now been impacted, because the pituitary gland is releasing these hormones. The pituitary gland is the master gland. It's directly connected to the pineal gland. So the pituitary gland is here, pineal gland is here. So they are directly feeding off each other. They are controlling the release of hormones from the ovaries, cortisol from the adrenals. Okay. So now what is happening? the entire body is now becoming weak because the mental body is affected. The energy bodies are also effective because the energy bodies are made up of subtle layers. So basically, your emotional body is in the energy bodies. So we experience our emotions not through the physical body, but through the energy bodies. The pranic body, the radiant body, the soul body, the subtle body, the aura, the arc line. We are experiencing it through this. So when the hormones are decreasing and the energy is not there, that means it's affecting now the heart chakra, the Manipura chakra, because you're accumulating negative emotions in the Manipura chakra because you can't process them. The heart chakra is not full of love and compassion because you're not giving yourself that self care. It's affecting the Nabi chakra, which has your vitality, the sacral chakra, which is surrounding all your sexual organs, your intestines, yeah, your genitals. The Mooladhara chakra, where the Kundalini energy is not active. So it's affecting the very pranic force with which you're born with, which is in the Mooladhara chakra, your effect. Then as you go up, the Vishuddha chakra. The Vishuddha chakra is connected directly to your thyroid and parathyroid. 95% women will develop a thyroid issue, mostly hypothyroid, where the thyroid starts to underwork. You could also get autoimmune disorders like Hashimoto's or MS or PCOS, different things like that, which I'm sure Dr. Purvi can talk about better than me. Now, all this is being affected. The Agnya chakra gets blocked because we don't use our intuition. A lot of women get migraines during their cycle. Why? Because they're constantly anxious, constantly thinking, overthinking, putting stress on themselves. And of course, the Sahasrara chakra, not many people, it is open in any case. But the Sahasrara chakra means you don't have a connection with the divine. So we are having stress, we're having emotional issues, and we are having hormonal issues during perimenopause and menopause. So, how does Kundalini Yoga help you? We have already established Kundalini Yoga is working with 10 bodies. Now, when you do a Kundalini Yoga class, every single chakra is activated. I also want to mention that we have more than 83,000 nadis. What is a nadi? They're called meridians in Chinese medicine. So if you have ever been to an acupressurist or an acupuncturist, with acupressure, they use their thumbs, the pads of their thumbs,
Yeah.
to activate certain energy zones. Okay. Also, there is a Kerala therapy known as Marma therapy, which is similar. It works on the meridians. And it's very painful when they start opening out the meridians because we are storing decades and decades of trauma in the meridians. Now, when we open the nadis, the chakras get energized. So in Kundalini Yoga, we are working on a very subtle level to open these nadis, all 83,000 of them. Okay? Because any trauma that you experience. So I'm also a multifunctional therapist, right? I do cellular release, I do different kinds of trauma release, somatic release. Now, any emotion that you are traumatized by, supposing something happened in your childhood. For example, if people made fun of you in school, that there were people who ganged up on you and made fun of you. Now that trauma is stuck in the cells and it's not healed. Because if you tell anybody, they'll say, oh, but everybody, if you tell your parents also sometimes, अरे बच्चों वाली बात है, सब लोग करते हैं, why are you being a drama queen? Right? And for boys, it's even worse because they're not even allowed to cry. So most men who grow up with anger issues are little boys who have been traumatized in their youth. They cannot show weakness through crying or through grief, so it comes out as anger. Because anger is actually grief and sadness. It is intense levels of grief and sadness. That is anger. So women who take all this emotion, or even women who are in unhappy marriages, or women who are ill-treated, or if they're having a friction with their mothers-in-law, or with anybody, or corporate women who are having friction with their team leaders and colleagues, All this trauma is now being stored in each and every cell of your body. And we have more than 83 trillion cells. So in my body, I have 83 trillion avrils. Dr. Purvi has 83 trillion Dr. Purvis. We have to understand this very carefully because the body never forgets. I may forget, you may forget, people around you will forget, but your body never forgets. There's a famous saying in psychology, the body keeps score. How does it keep score? This internal trauma, say somebody bullied you, you're not able to now stand up for yourself. Now, what happens to you when you become an adult? You become a people pleaser. Yeah. Anything that people tell you to do, you want to please them so badly, you just give in. Same in your house. You'll do the same pattern. Same thing at work. People who are not allowed to express their opinions, Vishuddha chakra gets blocked. So we cannot communicate properly at all. Either people misunderstand them, or they misunderstand people, or both happen, or they just keep silent because they are so scared to say what is actually on their mind. Now, all this is getting locked in the chakras. The Vishuddha chakra is blocked, the Agnya chakra is blocked, the Manipura chakras are blocked, the sacral chakras are blocked, and that is now causing you to have pain, discomfort, sometimes even tumor growths. Cancers are caused by a lot of anger and resentment in the body. Because as a pranic healer, we know, we are very well aware that each organ stores an emotion. Your lungs store sadness, your kidneys store fear, your stomach stores anxiety, your heart stores love or a lack of love, your liver stores anger, your pancreas, gallbladder also store toxic emotions like anger, grief. So, what is happening? The same thing with the bones. The tops of the shoulders store ancestral stress. The backs of the knees will store fear. The elbows store fear. The feet store, lack of stability. That's why the feet, the bones, there are 25 bones in the feet, if I'm not mistaken. Dr. Monali will know better than me. But I think there are 26 bones in the feet or more. All those bones are storing trauma. If your Mooladhara chakra is not working properly, all these bones and muscles below your waist are going to be impacted. So, what are we doing in Kundalini Yoga? We do Kriyas. What is a Kriya? A Kriya is a set of poses or what we call asanas in traditional yoga, using mantras, using mudras, using specific breath, and using something that we call in yoga pratyahara, sense withdrawal. So you go within, you practice with your eyes closed, you're chanting a particular mantra to activate your pineal gland. You're going within to see how am I feeling. You're calming your mind down because there's no outside stimulation because we take in the world 80% through our eyes. Okay? And you're practicing with yourself. You're not bothered about what is Monali doing, what is Sarita doing, what is Sneha. You're not bothered. This is your practice, you go within. We are not focusing on Bollywood poses, handstand, headstand, bakhasana, side crow, scorpion pose, mayurasana. We're not focusing on that. All those are great, but it requires a lot of skill. People going to yoga classes now because they want to put a picture on Instagram or they want to tell everybody, मैंने तो आज handstand किया. They're lying in the hospital. You can ask Dr. Monali also. A lot of people are getting injuries in a yoga class. They're going to a yoga class or to a gym to make their health better, but half the trainers there don't know what they are doing. They don't take an interest in the climb, and you end up suffering. Kundalini yoga is a very safe practice. I have clients who are even 75. I have one of my clients who's had 3 spinal surgeries. He still does the class because we provide modifications for everybody. So I am going to now just give you the opportunity to experience the magic of Kundalini yoga. I'm going to do one asana from a particular kriya. So I'm just lifting out one or two asanas from particular kriyas because we don't have time and we also want to take questions. Okay. So the first one I'm going to do is to release emotional trauma. I'm going to do something very specific to release emotional trauma. Then I'm going to do one thing to calm your mind. So, your stress levels, your anxiety levels, to calm your mind. And the last one I'm going to do is to do a meditation to regulate your hormones by activating the pituitary gland. Okay. So first, I'm going to demonstrate the first pose to you. You can sit comfortably. I intentionally chose poses where you don't need to be on a mat. You don't need to be, in some space where you need space to, go up and down. Anybody can do this. One thing I want to mention, if you have any contraindications like blood pressure, a heart condition, if you're on the first 3 days of your menses, if you're pregnant, if you have sciatica, if you have any respiratory or circulation issues, you should not use any kind of heavy or forceful breathing like Bhastrika, Kapala Bhati. So when I'm using Bhastrika now, please do not use it if you have these contraindications. You will still get the effect. You have to use long, slow, deep breathing or medium breathing. Okay. So just in and out through the nose. We are only using yogic breath in and out through the nose for the second and third one. The first one, we're going to be making an O shape with the mouth, and we're going to be breathing in and out through the mouth. Now, why do we use mouth breathing? To detoxify emotions in the organs. I want you to think of an emotion which is really, really upsetting you, like a very, very fierce emotion, particularly anger or irritation. So now I want you to really think about that emotion. So bring that emotion to mind. Okay. Let's work with anger because a lot of women have pent up anger because we cannot express it to people. So let's work with anger. Now, what are you angry about? You can bring that person to mind. You can bring that situation to mind. Okay. Now, once you close your eyes and take 10 seconds to bring that person or situation to mind, which is the object of your anger, okay? Then you're going to take your fingers. So in Kundalini Yoga, the thumb stands for ego. Okay? So we're going to take the thumbs and we're going to press it underneath the pinky finger on the moon mound. So we want to subdue the ego, and the moon has a cooling element. It's the Ida channel, the left channel, right? The Luna channel. So we want to cool the body because anger is a very fierce, hot emotion. Then we wrap the fingers around and we keep it right in front of the chest. Okay? You sit straight. Roll your eyes up if you can and focus at the third eye. Okay? And keep it there. So, first you can watch me and then we can practice for about, say, 45 seconds together. Now you're going to make an O shape with the mouth and you're going to breathe in and out through the mouth. Please be careful of the contraindications I mentioned earlier. Okay? You're taking your hand in a semicircle, pushing it back. Taking your hand in a semicircle, pushing it back. Taking your hand in a semicircle, pushing it back. But your hands are always in front of the heart. They do not go lower. So just watch me. Bring the person to mind with whom you are absolutely angry. Bring them to mind. It's absolutely magical. You will feel it in just 45 seconds to 1 minute. So bring that person to mind. What are you angry about? What has upset you or who has upset you? Thumbs will touch the moon mount. Wrap the fingers in front of the chest. Eyes rolled up to third eye. Open your mouth in a O. Breathe in. Keep going. Go as fast or slow as you can. Keep that picture in front of you and keep breathing in and out through the mouth. Keep going, keep going, keep going. Okay, keep on going. Don't stop. If you need to take a break, of course you can, but keep going. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now take a deep breath in through the nose. Now squeeze Moola Bandha. Remember, Dr. Monali told you about the pelvic floor, like you're trying to stop the flow of urination. Squeeze that muscle tight. And now imagine you're pulling the energy up, 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 up the spine till it reaches the third eye. Even if you can't, just imagine. The body doesn't know the difference. And now release, hands down. Take chin mudra, index and thumb touching. Go within. Check your mind. Feel the surge of energy in your body. And check your heart. Has the emotion of anger come down? Or maybe it has completely disappeared? What is your experience? If anybody would like to type in the chat or tell me how you're feeling, that would be nice so that I know what's happening.
It's definitely helping. The emotions definitely come down.
Yes, thank you. Great. I'm
It
happy to hear
is
that.
very,
Thank you.
very relaxing after doing it.
True.
Yes, very
Yeah.
relaxing.
Very
Absolutely.
relaxing. Yeah.
Feels very good. It's like a
Yes.
Yeah.
feel good emotion. Yeah.
Feel good, yeah, because now your hormones are getting activated because we're working with the hormone. In Kundalini Yoga, we work with the hormonal system. So now your feel good hormones are getting activated. And because you're working through it, through the breath, you're detoxifying anger from the liver. Okay? Because
Yeah.
breath is the best medicine. Pranayama, the science of breath, is the best medicine. You can heal your body, your mind, your soul through breath. So we'll just do one more. This is for your anxiety and stress level. So just take your thumbs, press them into your temple. So when you chew, this part moves, right? If you're
Yeah.
chewing,
Yeah.
that's what I want you to press, okay? And close your eyes, take your focus again to the third eye. And I want you to repeat a mantra. In Gurumukhi, it's called Satnam, which means I am true. So just repeat on the inhale, Sat, on the exhale, Nam. Relax the shoulders. Don't take the shoulders up to the ears. Relax. We'll do this for 1 minute to calm the mind down. It is called Temple Kriya. On the inhale, Sat. On the exhale, Nam. And keep your focus at the Agnya Chakra. Breathe long and breathe deep. Pit of your stomach, breathe in and release through the nose. Take a deep breath in. Squeeze Mula Bandhas. Try to stop the flow of urination. Pull those muscles in. Pick up the energy from the base of the spine. Imagine it like a light. It's flowing from the Mooladhara up, 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 up the spine, landing at the third eye. As you release, breathe out and bring your palms to your lap. Hold chin mudra and again go within. Every woman, every man will have their own experience. So you check and see how are you feeling. Slowly open your eyes. And for the last one, for your hormonal balance, we're going to do something called Sa Ta Na Ma. So this is a very powerful mantra to activate the pituitary gland and the pineal gland. and it means birth, life, death, rebirth. The cycle of samsara. Birth, life, death, rebirth. Why are we talking about the cycle of samsara to balance our hormones? Because hormones give life. Or if you don't have hormones, you don't live. If somebody were to cut off your pituitary gland, you would not survive, right? So hormones are life giving. And also, we want to bless ourselves so that we gain enough courage, enough powers of understanding so that we can free ourselves from the cycle of samsara. So we'll just be here for another 90 seconds, okay? In Kundalini Yoga, we do things in cycles 1.5 minutes, 3 minutes, 7 minutes, 11 minutes, and 33 minutes. So obviously, we don't have time to do more than 1.5 minutes, so we'll do 1.5 minutes. So be calm, keep your back straight. Energy only flows through a straight spine. Don't sit like this or lie down, straight. Keep your back straight, put a cushion behind if you have to. Rest your palms gently on your thighs, and I'll call out the mantra. Every time I call out the mantra, you change the finger, okay? So, Sa, the thumbs will touch the index, Ta, the middle finger, Na, the ring finger, Ma, okay? The pinky finger. Get ready. Long, deep breathing. Sa, Ta, Na, Ma, Sa, Ta, Na, Ma. Satana. You can also sing loudly. It's very soothing. So if you want, you can also sing loudly. Satanama. 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 Satanama, 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 Satanama. Rub your palms together, activating the nadis. Up your eyes. The eyes open into the palms and slowly straighten your elbows, bringing your palms parallel to the floor and then down on your lap. So that's all the time for. So the basic premise of Kundalini Yoga is it moves your body. So I've had a lot of women in perimenopause and menopause who were not getting regular cycles. Okay,
Okay.
they got their cycles back, including. And when you get your cycle back, when your hormones are balanced, you don't have adenomyosis. You don't get endometriosis. You won't get blood clots. You won't get pain. You won't get heavy bleeding. The period will come silently and it'll go.
Yeah.
And I also want to tell you that please don't look at your menopause or your period as a curse. I hear a lot of women who first come to Kundalini Yoga who say, "अरे यार फिर से ना वो महीने का हो गया है." With such disgust. That's absolutely wrong. Your body hears everything that you think, that you feel, that you say, that you speak, that you act.
Mm.
The body hears everything. So please remember this one line: the body keeps score because it needs to heal, it wants to heal. But because we are going on feeding it so much of toxicity from our own selves, we are not able to heal it. So I wish all of you here today a very, very beautiful perimenopausal and menopausal journey. Happy World Menopause Day. It's a celebration, it's not a curse. We are the only species who goes through so many phases in life.
Yes.
Men don't, animals don't have perimenopause and menopause. Only women go through it because nature has created us because we are now in the golden years of our life. We are grandmothers, we are aunties. We can pass on our wisdom of what we did as mothers to our children, to our grandchildren. So it is absolutely a miraculous process. So the first thing is embrace it and follow whatever Dr. Purvi, Dr. Monali have mentioned. And if you'd like to experience a Kundalini yoga class, you can contact Dr. Purvi. I think she's coming to a class tomorrow. She's signed up for a class tomorrow. So you can sign up for a class anytime. So I'm very happy to share this with you. Once again, thank you, everybody. And from my heart to your Satnam and Atma Namaste.
Thank you so much, Avril. That was really very pleasant and extremely relaxing experience. And now is the time for us to take the questions which have come up in the chat box. So I'll read one by one the questions which are here. So there is a question: what if, despite of following a healthy lifestyle with proper diet and exercise regime, yet weight doesn't come under control? What can be done? So, despite following a regular diet and exercise and a healthy lifestyle, the weight is not coming under control. So, what tip would you like to give to this question? Who would pick this up?
I'll 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 give first.
Okay.
So basically, what is your height? And related to height, what is your weight? There's a range of weight. So if you're following in that range, maybe it may be like higher range, no matter like what is the range of your weight. Second thing, are you feeling active? Are you feeling relaxed? Are you feeling, not like overwhelmed with lots of work and duties, and your life is going on smoothly? Up till that, there is no issue.
Hmm.
Second thing, if doing everything and also the weight is not getting down, then you need to go for some blood test. Check for your thyroid levels, check for your menopausal hormones levels like estrogen, progesterone, FSH, LH. Check for other issues if your body is having internally and you might not be knowing about it. And fourth is, don't be harsh on your body that my weight should be like this number. See, weight is a number. Big nutritionist, like we all know the famous like celebrity nutritionist Rutuja Divekar. She also tell that weight is just a number. Like, don't go behind that number.
Mhm.
As much as if you're following good healthy lifestyle, doing regular workout, don't think about weight only. You're doing all that to make yourself healthy and fit mentally, physically, and emotionally. So don't ना कई लोग mad हो जाते हैं कि weight नहीं कम हो रहा है, weight नहीं, but they are not looking towards the gratitude, the things which they are having in their life. So be grateful, look for the things you are having in your life, and you will see. Just do it for 1 month, write out the gratitude journal, and then follow all these things routinely what you are following, and see the miracle, because
And
you
I
are
think,
want.
yeah, and I
Yes,
think it is also about what do you know, what do you define as your correct weight? Sometimes
yes,
we have
yes,
a myth about that this is what the weight should be. Are you actually in need of that weight reduction, or you just are looking for no becoming thin and skinny because you feel that you will look beautiful as you will be very thin? So you have to understand whether your body needs weight reduction, till what weight reduction. I think you should consult the
yes,
doctor, go by that
yes,
advice. And as Avril has said, stop cursing yourselves. Sometimes weight
yes,
reduction is also emotional issue. The
yes.
constant remembrance, my weight is not reducing,
Hmm.
you're giving that particular feedback to
Yes.
yourself
Here
all
I
the
want to tell that that stress is taking you toward the increased cortisol level, and this cortisol level again is responsible for more and more fat deposition
Yeah,
in a particular area of the body.
yeah,
So again, that stress, anxiety leading to cortisol, spike, giving you lesser metabolism, less हो जाता है. Then your food digestion also gets affected, and again hormonal imbalance. So that
yeah.
it becomes a cycle. You will say that मैं तो अच्छे से खाना खाती हूँ, मैं एक्सरसाइज भी करती हूँ, फिर भी वेट नहीं कम हो रहा है, तो it may be anxiety related issue. So you need to check with visiting a doctor or consultant.
Yeah, okay. So, anybody wants to add to this, or should we move to the next question?
I think one more thing is that women should understand that you are not, your body is changing every 7 years. We get a brand new body. So don't expect, if you're 45, don't expect to look like what you were 35. And if you're 35, don't expect to look like what you were 25, because your hormones have gone on changing. Especially if
Yes.
you have been in childbirth, all those things, they take its own toll on the body. So please accept yourself the way you are.
Yeah, yeah, very true. So we have another question. Are some yogasans based on strength training?
Yes, yes. So yoga, if you do yoga with I keep saying trained instructor, because many people are saying I have done 200 hours of yoga, but doing 200 hours and knowing how to teach somebody is two totally different things. So you may be a good yoga practitioner for yourself, but are you able to assess your client's needs? That's what you should keep in mind. So coming
Hmm.
back, in Kundalini Yoga, we have very, very strenuous metabolic workouts, which some people say are equivalent to CrossFit, because we are using the strength of the body, like you would do functional training, you would do body weight exercises to strengthen the muscles. Also, we need to be very clear that when we are using our breath in a certain way, the muscles are getting worked,
Hmm.
because your breath strengthens your muscles. Your muscle strength will be nothing without breath, which is why in the gym also they say inhale, exhale. Why? Because if you work out incorrectly, you will be lifting weights, but number one, you'll injure yourself. Number two, your muscles will not fill. So in yoga, we are training the body, the mind, and the muscles together.
Correct.
Yeah.
I completely agree to what Avril has just said. So, strength training is not only the physical, the external weights that we use while exercising, it's also our own body weight that helps
Mhm.
again as a resistance and helps in increasing our body strength, which he rightly mentioned.
Yeah, thank you
Okay.
for making that distinction. Yeah.
Yeah. Okay. So we take the third question. How can we control autoimmune clinical parameters? Autoimmune
Autoimmune.
clinical parameters. I think maybe I do not understand what clinical parameters the person is
The
asking.
question is not clear, like
Yeah,
what exactly she
maybe
want to know.
the question is related to autoimmune
Yeah.
Autoimmune
diseases.
disease.
Yeah,
So
and
I have something to say about autoimmune. So, for example, supposing you're dealing with something like Hashimoto's, which a lot of women get during perimenopause or menopause, but they don't know, because when you go for a thyroid panel, they will check T3, T4, TSH. They don't normally do a thyroid serum test. So only a thyroid serum test will tell you what your TPO is. Okay. Now, the higher the TPO, you have Hashimoto's. So, for example, I had Hashimoto's and I controlled it with Kundalini Yoga. Because what is an autoimmune disease? It's your body's immunity fighting against itself.
yeah,
So, your healthy cells also, the thyroid is killing itself. So it causes Hashimoto's. So when we do a lot of thyroid kriyas, if we change our diet, then your parameters slowly start coming down. Also, I use something called, with my clients, called frequency healing. Frequency healing is the targeted frequencies via a frequency healing device to heal certain hormonal imbalances, mental, emotional imbalances in the body. Because everything is having a frequency. The thyroid is vibrating at a frequency. The pituitary gland is vibrating at a, so everything in the body is a vibration. So we have to target those vibrations using different kinds of therapies. So
hmm.
maybe the person is asking, how does she control what has come out in her clinical parameters. So maybe she got the parameters and now she's not sure how to control it. So first you can try doing therapies like this, because in allopathic medicine, unfortunately, there is no cure for
Nothing.
autoimmune disease.
Yeah, there's no
We
cure
know,
actually.
yeah, but we know very well that if you follow a particular diet, like an elimination diet, if you follow yoga, if you do frequency therapies, even if you do inner child healing, things like this, where there's a lot of trauma, there have been many, many thousands of cases all over the world where people have healed themselves from autoimmune. Currently, my Hashimoto's from 563 has come down to 249 in only 4 months. So it
Hmm.
is absolutely possible, but you have to make a lot of lifestyle changes.
Thank you, Avril, for that. We have another question. How long does post menopause last, and what do you call post menopause? So I think the
It's for
person who
lifetime.
continues,
It's
yeah,
for lifetime.
For lifetime. That's why I'm
You will
laughing.
die.
This post-menopause means rest of your life.
and all the years after the menopause is
And one third of our woman's age is in a
yeah,
post-menopause. One
yeah,
third of the women, they
and
live in a post-menopause.
she is asking, Mano is medicine fall under HRT or not? There is a medicine that name is Mano is, whether it falls under HRT or not. I think, Renuka ji, we need to check the compound. As
Yes,
you are in the
yes,
WhatsApp group, you may write it down. आप लिख सकती हैं व्हाट्सएप ग्रुप में कि मैनो इज अ ब्रांड नेम, तो
yes,
ब्रांड नेम के
Brandon.
अंदर क्या कंपाउंड है वो जानना जरूरी है। तो आप व्हाट्सएप ग्रुप में लिखिएगा एंड देन वी कैन मेक आउट के वो एचआरटी का पार्ट है या नहीं।
Yeah.
ओके,
Now so many companies are they are making Ayurvedic medicines,
Yes, yes, yes,
menopause.
yes.
So
Because
which is
actually,
Ayurvedic, which is allopathic, we can't make out from only name.
I don't think, Dr. Purvi, I don't think you can get HRT over the counter.
No, no, no,
yeah,
no,
it's
not at
not
all.
available,
It
it's
It's
has
not
to be
only on the
compounded.
prescription of gynecologist
And in
or
India, you have to,
OB-GYN.
yeah, in India, all HRT in India is compounded. It's not like the US where you
Yes.
can get
No,
over the
no. They
counter
have the gel and strips and like they're
everything.
having the in dissolving tablet
Yeah.
form, so many forms.
Over
and
here,
I
you
think
have to
it's
get it
yeah,
compounded.
and it's not even that cheap actually in India because it's not very
Yes,
popular,
yes,
so it's going
Yeah,
to be
it's
very
not.
yes.
costly
And you
to
will
Yeah,
not
it's
get
not.
like going to the medical store and getting this HRT tablet.
yeah.
It's not
And
She
so
says that
easy.
she's
yeah,
been prescribed this medicine, that is what
then
she's
she'll
writing.
have to, yeah,
Maybe
she'll have
Mano is, I feel it may be Ayurvedic medicine to ease
Yeah, it could be
menopause medicine.
like adaptogens. Like a lot of people use adaptogens like ashwagandha,
Yes.
rhodiola,
Yes,
certain
Ashwagandha, right.
adaptogens, you
Yeah.
know,
So
yeah.
maybe Renuka ji, you can just write it down in the WhatsApp
Yeah, in the
group and we
WhatsApp.
can discuss over there. She also has a question that she has gained 7 kgs from her standard weight within an year's time. But I think she hasn't commented anything
Great.
other than that. She's just informing. So, what exactly you are looking for? Like,
She can write in a group because
yeah,
if she's in a perimenopause, it's bound to happen. It's normal, and she can take control of her weight by changing her lifestyle and eating pattern and food intake.
yeah. So these are all the questions which have come up, and that is it. About people have been like listening to us past two I think 2 hours, and
Yes.
it has been so wonderful to have you all onto the platform with such good efforts you have put in. इतना सारा आज I'm sure this 2 hours have been very much milestone for many of the people जो लोग भी ये सुन रहे हैं या अब सुनेंगे because it's available on YouTube, they would be listening to it, and also all the demonstrations that they have got it. मुझे लगता है ये पूरा जो आज का पैकेज है वो नेक्स्ट मेनोपॉज डे तक चलेगा। हमने आज उनको इतना प्रोवाइड कर दिया है कि वो नेक्स्ट मेनोपॉज डे तक नो सेलिब्रेशन आएगा वापस तब तक
Right.
उनके लिए चलेगा। So on that note, let's end up today's talk, and hope
Yeah.
to see you all again on the same platform for some other topics related to menopause, and we can then still discuss it out with people around as we have menopause Menopause Club. And for friends who are willing to join, Rutuja, you may write an email to us or you may visit our website. We are available on almost all social media platforms. If you have your Instagram or Facebook ID, these are the no our Insta and the Facebook platforms. You can connect to us with for our different programs with this. There is also one session tomorrow of Dr. Purvi on general body and mental health during menopause. It's the same time, 7 o'clock. Join our YouTube channel and listen to more tips related to how to take care of your body and mind during menopause from Dr. Purvi. On that note, have a wonderful, good, tight sleep tonight. Thank you all guests for your
Thank you so
valuable
much.
time and
Thank
knowledge that you people shared on the floor. Rutuja had always been extremely obliged to have guests like you on the floor, and no, that's how we do the programs for the people. Without guests and without the participation, the NGO's role does not turn up. So, on that note, thank you all. Good night. See you all
Good
soon in the
night.
coming days. Thank you
Good
so much.
night.
Thank you. Good
Thank
night.
you,
thank
Good
you.
everyone.
night.
Good
Good
night.
Bye.
night.
Thank you.
Bye.
Bye.
See you.